very interesting subjects. We are going to start this session with Dr. Hassan Basha. Actually, Dr. Hassan Basha, he is one of the senior consultant cardiologists at King Fahd Army Hospital here in Jeddah. And he is going to talk about honey. And if honey, he's questioning, is honey has anti-diabetic effect? So, Dr. Hassan.
بسم الله الرحمن الرحيم والصلاة والسلام على سيد الخلق والمرسلين حبيبنا ومولانا وقائدنا محمد صلى الله عليه وسلم. Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, ladies and gentlemen. It's very difficult to give a talk first thing after lunch where actually the blood sugar is high up and everyone wants to sleep. So I think I will have a little difficult task to face. Now, this is actually the question, and we all know what God said in the Quran. أعوذ بالله من الشيطان الرجيم ثم كلي من كل الثمرات فاسلكي سبل ربك ذللا يخرج من بطونها شراب مختلف ألوانه فيه شفاء للناس. هذا قول الله سبحانه وتعالى. The Prophet Muhammad talks about the honey, and we know this hadith very well. Everyone knows it. A gulp of honey, where the healing is in three things: a gulp of honey, cupping, and cauterization. And the other hadith actually there is عليكم بالشفاءين العسل والقرآن. You should take the two that bring healing, honey and the Quran. So let's see what is going on in the honey. Honey contains more than 180 substances, including amino acids, vitamins, minerals, and enzymes. And of course, the composition is variable according to the nectar or actually the plant and so on. And look, on the contrary, what the sugar contains, it's composed of 99% of sucrose, and most of the benefits in the sugar initially, as it comes from the sugar cane, during the process, most of the benefits are, or most of the nutrients are destroyed. So this is a comparison between honey and sugar. And if we look actually there, I think you can, oops, sorry, I beg your pardon. Okay, I think this is a pointer. This is oops, sorry. I don't know which one is a pointer, but anyway, if we look actually there, the sugar, 99.9 actually is sugar, is actually, this is in fact here is sugar, while in fact the honey only 82% or 82 grams is sugar, and there is 17 grams water. Anyone knows how to work this, please? Which one is the pointer? This one? Huh? This one? Okay, but it's difficult to see. Anyway, never mind. So there are actually fructose and glucose in the honey. And on average, in fact, there are about 38% fructose and 30% glucose. Of course, this varies from honey to honey. Now, the two most widely investigated honeys in the literature are actually the Manuka honey from New Zealand and the Tuolang honey, which was actually published in 2011. And in fact, it used the glibenclamide or metformin combined with honey. They actually claim that it improves the glycemic control in diabetic rats. induced diabetes in rats. This is the first study in the literature which actually shows, according to the authors, that there was an increase in the serum level of insulin while there was a reduced serum concentration of glucose and fructosamine in diabetic rats. Now, another study which appeared actually a year later, or the same year, in fact, this is the same conclusion of that study. Sorry, I will talk about the other one in a moment. And what they concluded that the combination of glibenclamide or metformin with honey improves glycemic control. Another study, which was published 1 year later, and it talks about the effect of honey and elam and metformin, honey from elam, that's from Iran, and metformin for improving glycemic control, again in diabetic rats. And what actually, it is a study which was done on 30 rats, and they gave them metformin combined with honey, and they actually found lower levels of hyperglycemia, bilirubin, triglycerides, and cholesterol. So this is another study from rats. Again, more recently, this is August 2015, again the same thing actually, oral administration of honey in experimental model of diabetes showed a significant hypoglycemic effect. So that's another study again on rats. Dr. Irwaja from Malaysia, he wrote a nice article on honey as a novel anti-diabetic agent. And what actually the conclusion of that review is that the preclinical studies, which are the animal studies, provided more convincing evidence in support of honey as an anti-diabetic agent than the clinical studies did. The none too impressive clinical data could be attributed to poor study designs or due to the fact that the clinical studies were actually very preliminary in its early stage. So these are actually the mechanism they propose for honey to reduce blood sugar. Now, one of the hypotheses is that the fructose in the honey might contribute to the hypoglycemic effect of the honey itself. And let's see actually what they said in that review article, that the beneficial effects of fructose on glycemic control and glucose-regulated hormones, that it is there, and there is some evidence to support the role of fructose in the honey in mediating the hypoglycemic effect. Now, again, this is actually the main problem, that we need larger studies. We need larger studies before we make any conclusions. So I think we need the clinical studies, big studies on a human being before one can derive any conclusion on that. Now, there is another theory that oligosaccharides, which is present in the honey, that may contribute to the anti-diabetic effect of the honey. So that is another hypothesis there. Another review article written actually recently, a couple of years ago, in the Journal of Diabetes and Metabolic Disorders in 2014 on the effect of the honey in diabetic situations. And the authors actually raised several questions. Are the observed effects of honey or combined with anti-diabetic drugs exclusive to certain honeys? That's number one. The second question, could these beneficial effects be reproduced with other honey samples? That's another question. And therefore, more well-designed, rigorously conducted, randomized control studies are necessary to further validate these findings. Dr. Bassem Sheikh, who is with us actually here from Medina, he wrote actually this year in Journal of Taiba University, Medical Sciences. Again, he actually reiterated the same thing, that these studies were done on diabetes induced in the rats. So this is not a natural diabetes. And he actually stated that studies should be carried out in other animal models, such as high fat, fed obese animals, and so on, of course, in addition to human beings. Now, what are the studies on human beings? Let's see actually the effect on type 2 diabetes mellitus. This is a study from Pakistan, Journal of Medical Association, 2014, a comparison of glycemic response to honey and glucose in type 2 diabetes patients. Now, that's a study, a small study again, done on 97 type 2 diabetic patients. They were randomized into 3 groups. The first group were given 75 grams of honey. The second group given 30 grams of honey. And the third group, 75 grams of glucose. And let's see the effect of that. So after giving 75 grams of honey, the blood sugar went up by up to 85 milligram per deciliter. After only 30 grams of honey went up 30 milligram per deciliter. And look at how much it went up after 75 grams of glucose, 170 milligram per deciliter. So what actually the conclusion of this study, the authors concluded that low dose of honey can be a valuable sugar substitute. So let's look at that, substitute, not additional, for patients with diabetes. But again, this is a small study and always important to take the advice of the treating physician. I don't want anyone actually to go out and just take derive conclusions without asking the opinion of the treating physician. This is very important to emphasize. There was a study actually which was published just a few years ago on the effects of natural honey consumption in diabetic patients, only done for 8 weeks, and it was done on 48 diabetic patients. They were randomized into 2 groups. The honey group received oral natural honey for 8 weeks. The second group did not take the honey. And let's see what happened. After 8 weeks, the weight went down slightly from 70 kilos to 69 kilos, slightly. And what happened actually that the hemoglobin A1C in the honey group, it went up from 7.1 to 7.7, and that was statistically significant. So I think we have to watch out, we have to be careful. And this is the only study which reported potential detrimental effect of honey on hemoglobin A1C. But there are no studies, very little, very few studies. This is why behind the talk, this talk actually to stimulate the researchers to do proper studies. Because I think you cannot derive conclusions, as I said, from just 1 study or 2 studies and very small number of patients. So what they concluded that actually there was an increase in the hemoglobin A1C level was observed, and cautious consumption of this food by diabetic patients is recommended. So what about type 1 diabetes mellitus? I was surprised to see studies on type 1 diabetes. And what actually, this is a study which was published in 2011 and in a very good journal, Acta Diabetologica. So that's a good journal. And it actually looked at patients type 1 diabetes. They informed only 20 children and adolescents with type 1 diabetes. So that's a very small study. The mean age is almost 11 years. And they actually did oral sugar tolerance test and so on. And what they actually found that the glycemic index here in the diabetic patients was 1.19, while it was lower in those who got actually the honey rather than the sucrose. So the conclusion of that study, because of it is lower glycemic index, this is the honey lower glycemic index, when compared with the sucrose, it may be used as a sugar substitute, again, substitute instead of certain amount of sugar in patients with type 1 diabetes mellitus. Again, this is a very small study, as I said. Now, another study, which again published 2 or 3 years ago on the metabolic effects of honey in type 1 diabetes mellitus. And again, this is a study on 20 patients, again, aged 4 to 18 with the hemoglobin A1C less than 10%. Again, actually 12 weeks honey consumption in a dose of 0.5 ml per kilogram per day. So about, if somebody is 60 kilos, he will get about 30 grams per day of honey. And they actually reported a significant decrease in fasting blood glucose and hemoglobin A1C, just borderline significance here. So this is again a small study. This small study suggests that consumption of honey might have positive effects in the on the metabolic derangements in type 1 diabetes mellitus. Now, I will move on to the honey as an antioxidant. And there is actually more research on this. And this is, again, another review article which was published 3-4 years ago in the Journal of Molecules. And again, we know that actually now there are chronic diseases increased daily with these diseases are the diabetes, hypertension, atherosclerosis, cancer, Alzheimer's disease, and so on. And there is always some evidence that antioxidants may play actually a role in reducing these diseases. And we know that for many years that the free radicals and the reactive oxygen species have been implicated in the contributing to the process of aging and heart disease. Human beings protect themselves by actually some natural antioxidants in the food and other substances. So that's actually why, in fact, people started studying honey to see whether actually it has an effect as an antioxidant as well. And again here, this is actually, which in fact most of the studies are done in animals as well, but some are done in human beings. And what actually the conclusion of that review article, in view of the fact that the majority of these data emanate or come from animal studies, there is urgent need to investigate this antioxidant effect of honey in a human being. Now, this is a study on a human being from United States, from Illinois, that was published over 10 years ago on the عسل الحنطة السوداء, or what you call buckwheat honey. And this is actually a study again on 25, small study on 25 healthy men. And actually they looked at the serum antioxidant capacity, which increased following the consumption of buckwheat honey in water. Another study again from California on the antioxidants in human being. Again, this is another small study, as I said, and they actually give these participants 1.5 gram per kilogram body weight of corn syrup or buckwheat honey. And they actually looked at the antioxidant capacity, which in fact was increased, and the plasma total phenolic content, which is one of the reflectors of antioxidants, it increased in the plasma of these people. So what they concluded that these data support the concept that the phenolic antioxidants from the processed honey are bioavailable, and they increase antioxidants in the plasma. So that is encouraging, in fact, to see that. Now, what in the same review, or the same study, the authors actually stated very important thing that human beings or the human actually consume more than 70 kilograms per year of sweeteners, muhalliyat. So that actually they in fact were suggesting that maybe in fact replacing these some of these sweeteners with honey in healthy adults. So that's actually their suggestion. Now, we have to remember that 1 tablespoonful of honey comes in at, at 68, gives 68 calories, while 1 tablespoonful of sugar contains 49 calories. So one has to be, if he's going to replace one by one, he has to calculate it properly. He has to make sure that he is actually replacing something rather than adding up. So what about Saudi honey? This is a study actually was published 3 years ago, and this on the antioxidant effects. They looked at several types of honey in Saudi Arabia, the cedar and so on, Kina and so on. And their conclusion is that, in fact, it has been shown that there is actually antioxidant activity in all honey samples which were used in that study, and the summer samples have been shown to have highly effective capacity in antioxidants. Now, another recent study which was published in August 2015 on Turkish honey. We have speakers with us here, Turkish speakers, and this is actually a study. They studied 62 samples of honey, including 11 unifloral and 7 multifloral honeys. And again, they actually confirmed that there is, in fact, antioxidant effect in these honeys. More recently, again, this is 2016 in January, again on the potential biological activity of acacia honey. Acacia honey, another type of honey, which is also known to have a strong antioxidant and immunomodulatory potentials, and it could be a candidate for supplemental therapy in cancer patients and so on. So in conclusion, ladies and gentlemen, animal studies provide preliminary evidence for possible hypoglycemic effects of honey. Human studies are very small and not very impressive, and honey might be a novel antioxidant, and in view of limited data, larger and longer human studies are desperately needed for a clearer picture. With this, I will stop here, and thank you very much indeed for your attention.
Thank you very much دكتور باشا. It seems في الواقع انه الان يمكن الهاني ترى حيخلص من السوق. دكتور باشا لو سمحت بس. دكتور باشا. Yeah, I think maybe we have actually time for a couple of questions. Okay, the one there.
السلام عليكم ورحمة الله وبركاته. شكرا دكتور شمسي باشا for this good lectures. What about the Bangladeshi asal? Now there is honey Bangladeshi.
What about
For Bangladeshi honey. Now it is in the market, cheaper.
I have not come across actually proper studies on Bangladesh honey. As I said, actually most of the honeys was studied by in New Zealand by Peter Mullen, Professor Peter Mullen, who done tens of publications on the Manuka honey. And now the Malaysian people actually are also taking a good stride, and they are studying the Tulang honey, which is the main honey in Malaysia. But I have not come across actually studies on the Bangladeshian honey.
Question here.
Thank you, Doctor, for your good presentation for the honey. I have 3 questions. One of the questions is,
Wait, let's speak. Okay.
Yeah.
Yes.
Can you ask one question, and then if maybe we'll come back again to you, please.
we are surprising, Doctor, about the acacia honey. Everybody is claiming, every country is claiming this is acacia, and we are buying accordingly. what do you think? What is the basis for the acacia? Number one. Number two, if suppose the taste of the blood glucose for pre and post gives some errors, and the cumulative one is okay, what will be the result by using this honey? Thank you very much.
Thank you. Acacia honey actually has one characteristic which is quite high in fructose. Remember, the higher the fructose in the honey, the better the honey. Why? Because you know, when actually they obtain the honey from different parts of the world or different parts from the same country, they put them in large barrels. And then actually they expose them to heat, to about 60 degrees, 65 degrees, to make sure that they can be pumped or put in small matraban or small jugs. With that temperature, that actually can destroy some of the benefits of honey. So it is always better to have the honey which does not becomes actually crystallized. So the higher the fructose, the less crystallization, the less likely to be requiring heat to be in fact diluted again and put in small jugs. So that's one of the secrets of acacia honey. If you put acacia honey in the fridge for 1 year, it's unlikely to crystallize and to become a solid material.
If it's possible, you have a question here.
It's up to you. I'm asking another.
Yeah, just a minute. Maybe, do you have any question from upstairs, from the ladies? Okay. Do you have a mic there? حتى في الأسئلة يتأخروا سيدات.
ممكن نسأل احنا ولا؟
ايوه اتفضل. في الواقع
طيب،
الظاهر حتى في الأسئلة السيدات بيتأخروا. اتفضل.
دكتور شمسي، بس لو سمحت دحين انت on the same line from the previous question, do we have to use honey per se, or if we can use it in hot water or tea or whatever? Does this affect its quality?
In healthy population, actually, the Prophet Muhammad used to take the honey in water, dilute it in water. People actually may not like the taste of honey or afford taking a large tablespoonful of honey. You know, some people actually find it difficult to swallow. So it is perfectly fine. If you want actually to put it in water, that's absolutely fine. But don't expose honey or any antibiotic, for example,
لا,
to
in
high
hot water,
temperature.
يا دكتور, like in tea or something.
No, why not? But you will lose actually some benefits.
So it's better to use it in cold water, you mean?
In cold water. But if you're going to use, I'm talking about healthy population, if you're going to use honey in tea instead of sugar, it's certainly better than the sugar.
Thank you.
We have question here.
Okay, one question please.
السلام عليكم. بالنسبة لحضرتك آخر كلمة قلتها إنه الهاني في الشرب أو في الشاي أفضل من السكر. دحين في ضغط فظيع على عدم أو تقليل كمية السكر في الغذاء في كل الأحوال، وصار له أضرار أكثر. فهل الهاني بمعنى الكلمة يغطي، ولا المشكلة ممكن تنطبق كمان على الهاني؟ نمرة واحد. نمرة اثنين، بالنسبة للإكسبايري ديت، لأنه الهاني لما يقعد مع وقت حتى لو ما هو في الثلاجة بيتغير لونه بيصير غامق، فهل هذه لها معنى ولا لها فترة زمنية معينة؟ شكرا.
This is Professor Soira Islam.
Okay, thank you. Thank you very much. Very important questions. The first question actually about sugar in general. You know, actually people don't like الأبيضين، الملح والسكر nowadays. I think this is absolutely true.
والكوكين كمان.
Sorry?
الكريس
الأبيضين. الأبيضان الملح والسكر، الأسودان التمر والماء. That's a different story. I think what's very important to reduce sugar in general. This is actually now the advice which is given by all cardiac authorities and so on. So I think there is no question about that. So always important to be moderate. Allah subhanahu wa ta'ala يقول وَكُلُوا وَاشْرَبُوا وَلَا تُسْرِفُوا. We don't want extravaganza in anything in life. So that's, I think, very important. The second question, actually, the change of color in the fridge, right? I
خارج
don't think...
الفريج كمان وخارج الثلاجة برضو لما يقعد
أيوة.
يأثر
Yeah,
يتغير
I
لونه.
think this is because of the crystallization which occurs when the honey is exposed to cold temperature. So the crystallization of the honey itself produces this change in the color.
Okay, thank you very much, Dr. Basha. And I think we are going to go for the next speaker. Actually, I mean, Dr. Talal Al-Khatib, he's the head department of ENT supposed to give this lecture, but also we have one of our young doctors here, the, Dr. actually Rawan Arif. She will talk about تأثير القصد on the, I think, upper respiratory tract pharyngitis and acute tonsillitis. Dr. Rawan.
هذا الاسم
Good afternoon, everyone. Thanks for the organizing committee for giving me the chance to present my topic today about evaluating the therapeutic efficacy, tolerability, and safety of an aqueous extract of Costus speciosus in acute pharyngitis and acute tonsillitis, a pilot study. It's presented by Rawan Arif, teaching assistant, oral head and neck surgery, King Abdulaziz University. It was greatly supervised by Dr. Talal Al-Khatib. Authors have no conflict of interests, and the work was not supported or funded by any drug company. Acute pharyngitis is a self-limiting disease, and antibiotics are indicated only if the patient has not improved over a period of time. The antibiotics may cause a range of adverse effects. The overuse of antibiotics in respiratory tract infection is considered to be a significant cause of antibiotic resistance in the community. Costus speciosus rhizome classified under the genus of Costus lin. In traditional medicine, it has been used in many treatments such as in fever, asthma, tonsillitis, bronchitis, skin diseases, constipation, and snake and insect bites. سئل أنس عن كسب الحجام فذكر بمثله غير أنه قال إن أفضل ما تداويتم به الحجامة والقسط البحري ولا تعذبوا صبيانكم بالغمز. As documented by Anas ibn Malik, cupping and qast al-bahri are the best of your remedies, and do not harm your children by treating tonsillitis by pressing their tonsils. In light of the previous hadith, in addition, Srivastava et al. Confirmed that methanol extract of the Costus speciosus has significant anti-inflammatory, analgesic, as well as antipyretic activities in an animal study. Therefore, we conducted the pilot study to determine the objective and subjective effects, tolerability, and safety of the alternative treatment of aqueous costus spachiosis rhizome in pediatric and adult patients suffering from acute pharyngitis and tonsillitis. What we did is a pilot, non-randomized, non-controlled trial. It was held in ORL Head and Neck Clinic and Prophetic Medicine Clinic in King Abdulaziz University between May and December 2014. We included 15 patients. We prepared nasal drops by suspending the lyophilized extracted powder in distilled water at a concentration of 280 milligram per ml. For those who were ranged from 2 to 6 years, we gave them 210 milligram in form of 0.75 ml Q8 hours for 3 consecutive days. And for those who were aged above 6 years, we gave them 420 milligram in form of 1.5 ml of nasal drops, Q8 hours for 3 consecutive days. We included all male and female patients aged between 3 to 65 years. Acute pharyngitis or tonsillitis diagnosed by at least one otolaryngologist. We excluded all patients who used analgesia, antibiotics, topical throat pain medication recently, or even systemic corticosteroid, and those who participated in other clinical trials or those we lost the follow-up with. Subjective and objective measures were taken. For the subjective, we used diaries. We gave them to the patient. It was composed of 6 variables to be assessed by them every day of the 5 days, using a 4-point scale. Objective measures relied on the history and examination during the follow-up. All of these to assess either primary outcome, which is defined as remission, which means complete absence of all symptoms on day 5, or improvement, which is defined as any decrease in symptom severity from day 1 to 5. Data were analyzed using the statistical package for social science version 16, and p-value was set at a value of less than 0.05. We can see in this table the total score of 6 variants of symptoms among the 15 patients in every day of the 5 days. And we can see that 60% of them, the majority of them, reported improvement between day 1 to day 2, and 93.3% of them reached remission in day 5. In this table, the p-values between each of 2 consecutive days during the measurement duration of 5 days, and we can see in the second and the third line, the day 1 and day 2, a high statistical significant difference toward the improving of symptoms. In our study, use of costus extract in patients with acute pharyngitis and tonsillitis did not result in any reportable adverse effects. It's worth mentioning that the remission rate in the current study was similar to that associated with the use of antibiotics, as reported by Rigoli et al. They reported that patients who use antibiotics in the treatment of acute bacterial pharyngitis will demonstrate improvement by day 5. Acute pharyngitis is most commonly viral in origin, and bacteria causes accounts for only 5 to 10% of cases. And the need for antibiotics is commonly determined using centers criteria. And in general, group A beta hemolytic streptococcal pharyngitis is self-limited and resolves within a few days, even without treatment. Arguments for antibiotic treatments include acute symptom relief, prevention of suppurative and non-suppurative complications, and reduced communicability. Our limitations were the small sample size, the absence of a microbiological confirmation test, the absence of control group and double-blinded technique. To conclude, this pilot study revealed significant efficacy of the use of the aqueous extract of costus spachiosis in patients suffering from acute pharyngitis and tonsillitis. Demonstration of improvement in 60% of patients treated within the first 24 hours and 93% complete remission on day 5, without any adverse effects. We recommended conducting randomized double-blinded trial with a large group of patients to evaluate and compare the efficacy in patients with acute upper respiratory tract infections. Thank you. Any questions?
Thank you very much, Dr. Rawan, for this small pilot study, which is really, I mean, the results are very promising. And as you said, we need really maybe a good number of patients. So the floor is open for questions. Yeah, please.
Yes. Thank you very much for this very valuable and interesting study. But what about regarding the prevention of rheumatic heart disease? Actually, when you are giving the antibiotic, one of the things why we are giving it because to prevent rheumatic heart disease, and we're afraid if we don't give this, even if it is low possibility. So, what's your an impression about that point? Thank you very much.
دكتورة روان سمعت السؤال؟
Yes. Well, at first, the group A beta hemolytic streptococci at first to be the cause of this pharyngitis is very low. And then, if we're talking about the rheumatic heart disease, we're talking about a much lower percentage. And Dr. Talal, if he wants to comment on the answer.
Yes, thank you, Rowan. I agree with your answer. Basically, what we're talking about here is upper respiratory tract infection, pharyngitis, and viral tonsillitis. You're talking about complications of bacterial tonsillitis. And to diagnose that, we have a criteria which we excluded from our study because these type of patients will need antibiotic treatment. And it's unfair for patients to give them medication instead of approved medication that will reduce the bacterial load on their tonsils. So patients that we recruited did not have pus on their tonsils, did not have high fever, persistent. Otherwise, we would have treated them with antibiotics. Thank you.
Okay, we'll take this last question because the time, actually, we are short of time.
Sure, sure. And thank you. It was a very good presentation, and the selection of species was also a very good selection. I just had two questions on this. The method of preparation, does it has any reference? And two, is this plant is mentioned in prophetic medicine?
Yeah. I just want to show a slide. If I can. You asked about how did we prepare the nasal drops, you mean? If there is any evidence-based?
No, I'm asking, is there a reference? Is there a reference of the preparation? It can be prepared in different forms because this has a good evidence in most of the classical text. And this plant is available in most of the Asian areas and it has a good reference. This specific preparation from, it has a reference in which we have taken or it's your own thinking? How
no,
did you?
it was used as a nasal drops in another study, but we prepared it in our hospital. But yes, it's evidence-based, used as a nasal drops. But I think the preparation we used, it was innovated.
Yes, I agree with Rawan's comment. We tried to search for something standard already in the literature. We couldn't find. So we have to stand somewhere. So we thought to do a standard dose for young patients and double that dose for above 12 years of age. And see, I mean, this is an open floor for research. You can compare dosages, the sky's the limit. But we thought something to start, where the aim of our study is to show the safety and tolerability. Would patients actually be discomfortable from this? Because if we can use that, we can avoid other medications like Otrivine and things that patients will depend on and they have side effects. So that was the aim. We started with small dosages. We prepared it as a nasal dropper. And like we said, when they knew it's prophetic, when they knew maybe there was a placebo effect, we don't know. That's why the second step that we're taking is doing a randomized control trial and see what happens. The second question we didn't get actually.
Okay, I think, sorry, excuse me. The third actually talk will be more or less in the same line. So maybe if there is any questions, maybe you can just postpone it later.
عليكم ورحمة الله وبركاته. إن شاء الله بإذن الله اليوم حنقدم بحثنا عن اللي هو التأثير ضد البكتيريا للقسط الهندي أو البحري ومستخلصاتهم المائية على بعض البكتيريا الممرضة للجهاز التنفسي في الإنسان. تتميز معظم سلالات البكتيريا المسببة للأمراض في الجهاز التنفسي البشري، خاصة التي تسبب التهاب الرئوي والتهاب السحايا، أنها من البكتيريا المقاومة لمعظم مضادات الحيوية، أنها من السلالات البارزة والمنتشرة في معظم المستشفيات. كما وجد أن مشكلة هذه الدراسة أنه تم عزل بعض من سلالات البكتيريا من المرضى الذين يعانون من التهابات الجهاز التنفسي السفلي في السنوات الأخيرة. الاستهلاك الكبير للمضادات الحيوية في وحدة العناية المركزة لحماية المرضى من الالتهابات بعد العمليات الجراحية قد أدى إلى ظهور تلك المقاومة للبكتيريا. العدوى بالبكتيريا المسببة للالتهاب الرئوي يمكن أن تنتقل عن طريق استخدام أجهزة التنفس في المستشفيات، خاصة في المرضى الذين يعانون من ضعف جهاز المناعة. طبعا هذه اللي وجدت في الأبحاث السابقة. البكتيريا المستخدمة في هذه الدراسة طبعا تم استخدام 4 أنواع من البكتيريا، هي باسيدوموناس إرجينوزا، ستافيلوكوكس أوريوس، كلابسيلا بينوميا، إشريشيا كولاي. وجد أن معظمها بتصيب اللي هو أو بتسبب ذات الرئة والالتهاب الرئوي، خاصة في المرضى ضعيفي المناعة، واللي بيستخدموا كمان الأجهزة الطبية ممكن بتنتقل هذه البكتيريا عن طريق أجهزة التنفس الصناعي. الهدف من الدراسة إيجاد بدائل طبيعية ناجعة في علاج البكتيريا التي تصيب الجهاز التنفسي في الإنسان، محاولة التقليل من مخاطر استخدام المضادات الحيوية المستخدمة في علاج الالتهابات الرئوية، إحياء التداوي بالطب النبوي عن طريق الأبحاث العلمية المثبتة بالبراهين. النص المعجز: قال صلى الله عليه وسلم: لا تعذبوا صبيانكم بالغمز من العذرة وعليكم بالقسط، بالإضافة إلى قوله صلى الله عليه وسلم: عليكم بهذا العود الهندي فإن فيه 7 أشفية يصعط به العذرة ويلد به من ذات الجنب. طبعا هذا الحديث كان المنطلق الأول في بداية هذه الدراسات، ولكن استوقفتني بعض العبارات الموجودة فيه، والتي حاولت أني قدر المستطاع ألاقي اللي هي طبعاً المعاجم أو المفسرات اللي هي تفسر لي بعض الألفاظ التي ذكرت في هذه الحديث. فكانت شواهد الحديث أول طبعاً كطبيعة أي باحث بتثار في عدد من الأسئلة: ما هو القسط الهندي وأنواعه؟ ما هي العذرة؟ كيف يكون الصعود أو الصعط؟ ما المقصود بذات الجنب؟ طبعا وخاصة أنه هذه الدراسة ما كانت، أو دراسة اللي على القسط الهندي ما كانت موجودة في السعودية، وإنما كانت منتشرة بشكل كبير في الهند. طبعا نرجع لتفسير شواهد الحديث. شواهد الحديث: العذرة هي وجع في الحلق بيهيج من الدم، وتسميه العامة بنات الأذن، وهذا التفسير يوافق في الطب أمراض الحلق التي تترافق باحتقان دموي. ذات الجنب هو التهاب يصيب الجنبة أو البلورة، وهو غشاء مزدوج الطبقة يحيط بالرئتين ويفصلهما عن جدار الصدر. تحدث ذات الجنب كمضاعفة لبعض الأمراض الأخرى مثل الالتهاب الرئوي. الصعد أو الصعود وهو أن يستلقي المريض على ظهره ويجعل ما بين كتفيه يرفعهما لينحدر رأسه ويقطر في أنفه ماء أو دهنا فيه دواء حتى ينطبق بالعومه الخلفي لاستخدام أو لاستخراج ما فيه من الداء بالصعد. ومن هذا المنطلق كانت شواهد الحديث هي أول البداية في طبعا استخدام القسط في أو تطبيقه على علاج الأمراض التنفسية، وكانت بداية البحث في استخدام نبات القسط. نبات القسط بيندرج تحت عائلة الزنجبيليات، ويؤخذ من نبتة القسط التي يبلغ ارتفاع 1.5 مترا، ولها أوراق وساق وجذور. يوجد في الهند، تنمو على سفوح رطبة من جبال الهيمالايا. القسط الهندي والقسط البحري، وهو ما عني في الدراسة. القسط الهندي بيتميز بأنه غليظ أسود مر المذاق شديد الحرارة، بينما القسط البحري أبيض اللون أقل مرارة من القسط الهندي. والجزء المستخدم في هذه الدراسة هي جذور القسط الهندي والبحري. الدراسات البحثية التي قمنا بها من عام 2009 في القسط الهندي بتتضمن التعرف على تأثير جذور نبات القسط الهندي أو البحري. طبعا استخدمنا في الدراسات أو في الأبحاث 3 اتجاهات. أول حاجة استخدمنا الجذور الجافة والمطحونة على صورة بودرة، المستخلصات المائية على الساخن وعلى البارد، المستخلصات الكيميائية تم فصل اللي هي طبعا الزيوت العطرية والمستخلصات الكحولية. يتضح من الشكل الأول تأثير تركيزات مختلفة من جذور نبات القسط الهندي والبحري على نمو بعض البكتيريا الممرضة للجهاز التنفسي في الإنسان. واتضح طبعا أنه بزيادة تأثير القسط الهندي أو البحري كان له تأثير فعال على نمو البكتيريا، خاصة في التركيزات المرتفعة منهم، كما تتضح ذلك من الصورة التالية، وتأثيره على نمو بكتيريا كلابسيلا بنوميا عند تركيز 20% من القسط الهندي. الصورة التالية اللي طبعا بكتيريا ستافيلوكوكس أوريوس عند تركيز طبعا تركيز اللي هو 15%، وكان طبعا أيضا قاتل للبكتيريا. الدراسة التالية أو التجربة التالية كانت أيضاً على جذور الجافة والمطحونة من القسط الهندي أو البحري، وتم اختيار نوعين من البكتيريا ستافيلوكوكس أوريوس and كلابسيلا بينوميا لإجراء اختبار التأثير المثبط والقاتل لجذور نبات القسط، وذلك بسبب أنها تعد من أكثر البكتيريا المسببة للالتهاب الرئوي في المستشفيات. طبعا هذه الدراسة عشان توضح لنا هل هذه البكتيريا في المستقبل حتكون مقاومة أيضا لنبات القسط أو لا. اتضح من الشكل تأثير تركيزات مختلفة من جذور نبات القسط الهندي والبحري على الوزن الجاف والنسبة المئوية لبكتيريا كلابسيلا بينوميا and ستافيلوكوكس أوريوس بعد إعادة تنميتها على نفس التركيزات لتحديد التركيز المثبط والقاتل للقسط. وجد أنه في الفترة الأولى كان هناك تأثير تثبيطي على نمو البكتيريا بزيادة التركيزات، وعند تنمية البكتيريا مرة أخرى على نفس التركيزات من الأطباق السابقة وجد أن التأثير ما زال مستمراً في الفترة الثانية والثالثة، ويعني ذلك أنه كان قاتلاً لنمو هذه البكتيريتين. الشكل التالي بيوضح تأثير تركيزات مختلفة من المستخلصات المائية لنبات القسط الهندي على الوزن الجاف والنسبة المئوية لبكتيريا كلابسيلا نيمونيا and ستافيلوكوكس أوريوس. وجد أن المستخلصات أيضاً المائية سواء على الساخن أو على البارد كان لها تأثير تثبيطي على نمو كلابسيلا نيمونيا لنوعي القسط سواء البحري أو الهندي. أيضاً استمر التأثير التثبيطي في التركيزات على بكتيريا ستافيلوكوكس أوريوس في جميع التركيزات، خاصة من تركيز 10 إلى تركيز 25% سواء على تقريباً على المستخلصات على الساخن. طبعاً وهذا التأثير اللي هو تأثير تركيز 20% من المستخلص المائي للقسط الهندي على بكتيريا أو على نمو كلابسيلا نيمونيا، وتأثير 15% من المستخلص المائي للقسط البحري على الساخن على نمو ستافيلوكوكس أوريوس. ملخص النتائج: اتضح من النتائج السابقة أن القسط الهندي والبحري كان لهما تأثيراً فعالاً ومثبطاً على نمو البكتيريا المختبرة والممرضة والإنسان، وكمان ممكن بيكون قاتل على هذه البكتيريا. استخدام أنواع القسط بعدة طرق مختلفة في علاج الحالات المرضية والتي تسببها البكتيريا المختبرة كما ورد في الأحاديث النبوية، سواء على الصورة الجافة أو في مستخلصات مائية. وجود العديد من المواد الفعالة في أنواع القسط، حيث أثبتت الدراسات التالية لهذه الدراسة وجود مواد كيميائية فعالة مثل الزيوت العطرية والاسترويدات. أوجه الإعجاز العلمي. أن رسولنا الكريم صلى الله عليه وسلم دلنا من خلال الأحاديث النبوية على عدم الغمز والضغط على أماكن تضخم اللوزتين عند الأطفال، وهو ما يعرف بالعذرة، ليسيل الدم من الأنف مما يسبب الأذى والألم للطفل وعدم شفاء الداء. توجيه الرسول صلى الله عليه وسلم إلى استخدام عن طريق الصعود في علاج الأمراض التنفسية، وهو ما ورد في الأحاديث بلفظ العذرة وذات الجنب. أوضح الرسول صلى الله عليه وسلم: عليكم بهذا العود الهندي فإن فيه 7 أشفية يصعد به العذرة ويلد به من ذات الجنب، حيث أن التداوي بالقسط فيه 7 أشفية، وقد فسره عدد من العلماء أنه ربما يكون في طريقة الاستخدام، أو الاحتمال الأمثل أنه يداوي 7 من الأمراض التي تصيب الإنسان. أهمية التداوي بالقسط وأنواعه والتي ذكرت في الأحاديث النبوية، حيث أثبتت فعاليتها الدراسات العلمية الحديثة، حيث أنه يحتوي على مواد فعالة ذات تأثير تثبيطي على نمو البكتيريا التي تصيب الجهاز التنفسي في الإنسان، خاصة الإنفلونزا، الربو والسعال وأمراض الرئة، حيث أن الباحثين في الوقت الحاضر يبحثون عن بدائل ناجعة للتداوي ولتقليل من أخطار استخدام مضادات الحيوية التي أصبحت مصدراً للخطر على الصحة العامة، بالإضافة إلى أنها تسبب آثاراً جانبية حادة وأحياناً غير متوقعة، خاصة إذا استخدمت لفترات طويلة فتحدث ضعف عام للمناعة. كشف العلم الحديث عدداً من أسرار الطب النبوي في علاج العديد من الأمراض التي تصيب الإنسان، مما يدلنا على أن العلم والدين وحدة واحدة لا تتجزأ، وعليه دوماً كباحثين الخوض في هذا العلم الذي هو هداية من رب العالمين، والذي نفتخر به كمسلمين، حيث أنه منهج إسلامي متكامل. وآخر طبعاً دراستي: لك الحمد إلهي بكل فكر موحد مترنم، أوحيت لخير البرية بكل معجز معلم، نوراً أضاء في طريق كل عالم متعلم، صلاة وسلام ننال بها شرف كل مبسم.
شكرا دكتورة منال, but really I think we do apologize for not able to take any questions now because we are short of time. Now the next speaker will be Professor أحمد حجازي. دكتور أحمد حجازي من المركز القومي للبحوث في القاهرة، وهو عضو اللجنة الدولية للعلاج بمنتجات النحل وسكرتير الاتحاد الأفريقي للنحل. He will talk about the, I think the venom has antibacterial effect.
سعاد الجاعوني للدعوة الكريمة التي وجهتها لي أنا وزملائي، وهتكلم النهاردة بإذن الله على is the bee venom having antibacterial activity. نكاء عربي ولا إنجليزي يا أخوانا؟ النبي عربي صلى الله عليه وسلم. دلوقتي النحل، مملكة النحل هي بتيجي، أو التقسيم التشريحي بتاع النحل إن هو من مملكة النحل توصل للجنس بتاعه اللي هو إيبز مليفرا. ومن الناحية التاريخية أولا أول من استأنس النحل هم الفراعنة منذ 7000 عام، وإن هو كان بيرمزوا للملك أنه نشيط، بيحطوا على دماغه نحلة وزهرة، ويمكن ده السيمبول بتاعها اللي انتوا حضراتكم شايفينها، اسمها C&2 اللي هي النحلة، وده معناه أنه هو موحد القطرين. وهذه الصورة أيضا على المعابد في الأقصر، ودي كيفية أن هم بيجمعوا النحل فيها. بالنسبة للنحل نفسه، التركيب التشريحي للنحلة، في نهاية النحلة في هنا الغدة المنتجة للسم. في بوينتر والله إذا تكرمت ولا ما في؟ فدي الغدة اللي هي بتعمل، شكلها بتبقى زي اللانست، زي السهم كده ومتعرجة، ولذلك التعرج ده لما النحلة تحدث لدغة في الجلد، لما تيجي تجذب الجلد بيبدأ في المنشار ده يقف في الخلية ولا يحدث معاه أي شيء، فتموت النحلة بعد كده وتضحي بنفسها. طبعا زي حضراتكم ما عارفين ان الآية الكريمة وأوحى ربك إلى النحل أن اتخذي من الجبال بيوتا ومن الشجر ومما يعرشون ثم كلي من كل الثمرات فاسلكي سبل ربك ذللا يخرج من بطونها شراب مختلف ألوانه فيه شفاء للناس إن في ذلك لآية لقوم يتفكرون. فمن هذا المنطلق أنه يخرج من بطونها شراب مختلف ألوانه، فسم النحل بيخرج من بطن النحلة فهو شراب مختلف ألوانه، وأي أنواع المنتجات التي تخرج من النحلة. فالنحل ده هو مركب معقد جدا متكون من إنزيمات ومن بروتينات وأمينو أسيد، واللي هو بيبقى لونه ملوش لون وهو له تيست كده. كل حاجات النحلة على فكرة كل حاجاتها بتبقى طعمها حلو لأنها هي بتاكل الحاجة الحلوة. هو بيذوب في الماء وفي الكحول، وبعد كده ان هو لما بيجي يتعرض للهواء بيتجمد، ولذلك هو نقدر نجمع سم النحل بالطريقة دي. لو هو البي اتش بتاعه 5 ومن 5 ل 5.5 اللي بيبقى ليكويد وكارلس، وهو بيبقى بيتر في الطبيعي، ولما يجف بيبقى لونه أصفر، والليسال دوز 50 بتاعه بيبقى 2.8 ملي جرام لكل كيلو جرام إذا كان في الماوس اللي هو بيستخدمه. يعني هو بيبقى سيف جدا وما بيتأثرش. طيب احنا عندنا بيتكون منه البيبتيدات مجموعة الميلتين والأدلوبين والدوبامين، وفي عندنا انزيم فوسفولايبيز A1 و 2 وهيالورونيديز انزيم، وفي عندنا اكتيف امين زي الهستامين والدوبامين والنور ابنفرين والليكوترين، والنون بيبتايد عندنا شوية كربوهيدرات في جلوكوز وفركتوز. كل ده التركيب الكيماوي بتاع العسل بتاع سم النحل. فبالتالي هذه الأشياء كلها تؤثر على كفاءة سم النحل. هو نستخدمه كنحل باللدغ أو بأننا نحلب النحلة دي على جهاز بالكهرباء، تبدأ النحلة تضع السم عليه، وزي ما بنقول حضراتكم عند درجة 25 درجة مئوية هو بيجف، ونبدأ نعمل له سكرين من عليها ونبدأ ناخده ونخففه ونعيد تركيبه تاني. هو عنده بايوميديكال ابليكيشن في الفولك ميديسن من أيام الفراعنة وهم بيستخدموا سم النحل، ولكن بعد كده في الطب الحديث بدأوا يستخدموه للأمراض المتعددة مالتيبل سكلروزس، ويمكن الصبح اتكلمنا على الروماتيك ارثرايتس والانفكشس ديزيزز. هو له لوت اوف اكتيفيتي بيولوجيكال اكتيفيتي ممكن احنا نعملها، ولكن دلوقتي ممكن نستخدمه كأنتي ميكروبيال اكتيفيتي ولا لا. هنا ابحاث متعدده كثيره استخدمت الانتي بكتيريال اكتيفيتي وبتاع الثعابين وسم النحل، ووجدوا ان هو بيدينا انديكيشن ان هو ممكن يعمل لنا مضاد للميكروبات. ده طبعا كل هنا البي فينا ملتين على الاشريشيا كولاي، بدأوا يدرسوا الفراكشنز بتاعتها على الميكروبات المتعددة، ودي كلها دي أبحاث هي منشورة وموجودة على الريتريتشرز، أو لو أي حد يبدأ يدور عليها في الباب ميد والكلام ده نجد إن هو سم النحل لما يعمل له ايزوليشن يبقى هو ريماركابل انتي بكتيريال بيبتايدز اللي هي بتبدأ في النحل، ودي هي اللي بتأثر تعمل لنا هاي انتي ميكروبيال اكتيفيتي اجينست جرام بوزيتيف والجرام نيجاتيف بكتيريا. وفي عندنا ايضا في اشياء متعدده. البي فينم انهبت الجروس بتاع البكتيريا، وبيبدا السترونج انتي مايكروبيال اكتيفيتي كان بيبقى على الجرام نيجاتيف والجرام بوزيتيف بكتيريا، وده عديد من الباحثين اشتغلوا فيه، وخاصه لما بنثبط نمو الستافيلوكوكس اوريوس والسيودوموناس ومع مجموعة كثيرة من العائلات الميكروبية. وكما الأخت الفاضلة تكلمت سابقا بتقول احنا عندنا مشكلة الهازارد بتاع الدراج ريزيستنس، الميكروبات دلوقتي أو البكتيريا بقى بدأت يبقى عندها مناعة ضد المضادات الحيوية، فبالتالي احنا بندور على، ودي كلها دي أبحاث منشورة على الأنتي ميكروبيال أكتيفيتي موجودة. طيب احنا بالنسبه للشغل اللي احنا عملناه عندنا بدانا نقول ايه، وده يمكن بحث بتاعي ايفالويشن للانتي مايكروبيال. عملنا ايفالويشن لديفرنت سورسز من الجرام بكتيريا وبوزيتيف والنيجاتيف، وخاصه اللي هم الدراج ريزيستنت، وخدنا الايه سم النحل اللي احنا عزلناه، والباثوجينيك بكتيريا اللي احنا اشتغلنا عليها ستافيلوكوكس اوريوس وستريبتوكوكس بايوجينس كليبسيلا نوموني واشريشيا كولاي سيودوموناس ارجينوزا. كل الاشياء دي استخدمناها، وبرضه بينت لنا ان النتائج هنا اظهرت انديكيت البي فينم inhibit the growth and survival of bacterial strain and can be used a complementary antimicrobial activity against pathogenic microbacteria against bacteria. هنا الليفل بتاع الميكروبات اللي احنا استخدمناها، وده خاصة في لو احنا بنشوف لو انا اخدت في التجربة عملت مقارنة بين السم النحل اللي جاي من كندا والسم النحل اللي موجود في مصر، وفي هيئة المصل واللقاح بتطلع برضو منتج، وبعد كده أنا استخلصت سم النحل من النحل كلها، وبدأت أقول الديفرنت سورسز، هل الأكتيفيتي بتاع سم النحل ده بتتأثر ولا كبوتنت أنتي مايكروبيال أكتيفيتي ولا لأ. فبالتالي وعملنا لها MIS اللي هو مينيمال انهبيتوري كونسنتريشن، وبدانا نصل قد ايه كميه الايه من المايكروجرامز اللي ممكن نستخدمها. وفي دراسه ثانيه عملنا انتي بكتيريال اكتيفيتي كولكتد من سترين معين اسمه كرانيولي هاني، وبدانا نبدا نشوفه. ده عملناه بالالكتريك شوك للبكتيريا عشان نحلب على جلاس هذا السم ونجمعه ونبدا نستخدمه. طيب بنستخدمه برضه على ضد الميكروبات المتعدده، ستافيلوكوكس اوريوس، ستافيلوكوكس بايوجينس، كليبسيلا نيموني، اشريشيا كولاي سيودوموناس. وبرضه وجدنا ان انا خدت الكرانيولي سترين ده ريس بيور والهايبريد بتاعه، هل هناك فرق بينهم زي ما وجدنا في المجموعه اللي فاتت لما جبنا انواع متعدده من سم النحل من مصادر مختلفه، وجدنا ان هو بيشتغل معاها وبيدي نتيجه طيبه. طيب لما نقول السترين نفسه، هل النحله الكرانيولي او الهايبريد بتاعتها هل في فاريشن، لان الناس اللي بتربي النحل وبتبدا تستخلص سم النحل منها هل هي لها فاعليه ولا لا؟ ووجدنا ان الاثنين لما بنشوف بنجمع سم النحل من المصادر بأسبوع الأول والثاني والثالث والرابع، وبعد كده بدأنا نجربها على الميكروبات، وبالتالي وجدنا في عملناها برضو بطريقتين. في عندهم في تجميع السم يا إما يتجمع على إزاز يا إما يتجمع على بلاستيك، ونشوف الفاعلية بتاعت ده هل هتتغير من ده إلى ده ولا لأ. ووجدنا إن الميكروبات لما بنحطها عليها هي الكفاءة بتاع سم النحل whatever إذا كان من السبيشيز ده أو من الهايبريد بتاعه أو من على الإزاز أو على البلاستيك، هو بيدي نفس النتائج، بس في فاريشن طبعا في التركيز بتاعه. يبقى في النهاية وصلنا إن النتائج اللي موجودين إن سم النحل اللي بيتجمع من ده أو من ده ضد الميكروبات المتعددة يمكن يعطي لي أنتي مايكروبيال أكتيفيتي فوق أجينست الفايف بكتيريال سترين اللي احنا استخدمناها. وبعد وبعدين الريزلت دي بتاع البي فينم دي inhibit the growth of and survival of bacterial strain that B venom may be useful as a complementary antimicrobial agent against pathogenic bacteria even if the venom collected from the different methods. ولذلك على فكرة احنا بنحط الستيتمنت دي اللي احنا بنقول ايه ان هو هذا السم بنقول كومبلمنتري، عشان لو انا بقول ان هو شارب كده هنلاقي هجوم علينا من جهات مختلفه، ولكن بنخفف الوطء ونقول ان هو از كومبلمنتري ميديسن في هذه الاشياء. فده يحقق قول الله سبحانه وتعالى انه سيرينا الآيات في الآفاق حتى يتبين لنا أنه هو الحق من الله سبحانه وتعالى، ومصداقا للحبيب صلى الله عليه وسلم اللي هو إن هو بدأ ينهى عن قتل النحل، نهى قتل النحل لأهميتها الطبية والأهمية العلاجية والأهمية الغذائية. فطبعا ومصداقا للقرآن الكريم يخرج من بطونها شراب مختلف ألوانه، يعني اختلاف الأنواع التي تخرج من النحل، وسم النحل بيخرج من بطن النحل، فبالتالي يبين لنا. ده المكان اللي أنا بشتغل فيه، المركز القومي للبحوث، ودولة المجموعة اللي بيشتغلوا معايا، والحمد لله معظمهم معانا هنا بيقدم محاضراتهم. وطبعا أنا في استعداد أنا وزملائي إن احنا نبدأ نتعاون مع حضراتكم ومع أي حد من أي جهة، لأن العلم ده صدقة جارية وعلم ينتفع به لكل الناس، وربنا يكرمنا ويكرمكم بأن احنا نحقق هذا الأمل. وبشكركم لحسن الاستماع، والسلام عليكم ورحمة الله وبركاته. أنا آسف بقى اتكلمت بالعربي.
لا بالعكس، شكرا بروف حجازي. هتتكلم عن فعالية عسل السدر effectiveness of cedar honey with its role of antioxidants and anti-apoptotic mechanism. Do you have the lecture? ما تتذكر دكتورة منال؟ الدكتورة منال موجودة؟
لا ما هي موجودة، ما جات.
منال طه
بتكلم، ما احنا شايفين احد.
طيب
احنا عندنا مشاركة.
عندك مشاركة؟
ايوه ممكن.
ما حضرت
سؤال. اوكي we can take really maybe couple of questions. تفضلي.
نبدأ.
تفضلي.
السلام عليكم، أنا دكتورة هند أحمد، استشارة نساء وتوليد وعقم أطفال الأنابيب، مكة المكرمة. أول مشاركة مع الدكتور أحمد حجازي، جزاك الله خير. أنا يعني متبنية مشاركة أبحاث جميع الباحثين في إنتاجها من البحث العلمي إلى الإند برودكت للناس، فاللي حابب يتعاون معايا فأنا تحت أمره إن شاء الله بإذن الله تعالى.
طيب.
رقم 2 مشاركتي مع الدكتورة منال والقسط الهندي، وأنا يعني أدعو الله عز وجل يبارك لكل من ساعد في إخراج القسط الهندي، لأنه تكلم عنها الرسول صلى الله عليه وسلم من 14 قرن عن العذراء. واليوم لو رحت شفت البيشة، هناك معالجة في البيشة تعالج زي خالتي نوسة. تعرفوا خالتي نوسة؟ أقسم بالله العلي العظيم تعالج بقطع أو فرص أو استخراج اللويزات بيدها، تدخل يدها. أنا رئيسة اللجنة العلمية في الإعجاز العلمي في مكة المكرمة، فبالتالي لازم أبحث عن الأمور اللي هي ضد الطب الإعجاز العلمي. فرحنا زرناها ببيتها، حجزها من الساعة 4 صباحا، كل الناس مربايين حوالين البيت حقها. الكشف ب500 ريال، دخلنا عشان نكشف، قدمت بنتي عشان أشوف هي بتعمل إيه، فبتدخل إصبعها وتروح تضغط على اللويزات ألين ما تطلع الدم من الخشم. موجودة على اليوتيوب، ولا حساب ولا عقاب، موجودة اليوم عندنا في بيشة. طيب إلى اليوم.
دكتورة لو سمحتي معلش، نحن هنا
أنا مشاركتي إنه القسط الهندي يعادل كل هذه الأشياء اللي بتصير، فواجبنا الآن نحن ننشر على كل المحطات، فضائية، يوتيوب، كل العالمات اللي بحثوا وطلعوا هذا الأمر، ولله الحمد.
طيب أنا أفتكر في المؤتمر ده نحن واجبنا برضو إنه أي حاجة not evidence based we should not really يعني نستعملها بانتشار. we have to be very careful. على كل حال
أبحاثهم ما شاء الله ممتازة رائعة، يعني حتى
طيب
اللي بده يشاركنا إحنا ننشرها بإذن الله تعالى.
And really, at the end of the session, we would like to thank you very much and to thank the speakers. And I think we maybe will see you after the coffee break. Thank you very much.
First of all, I would like to thank the organizers for giving me an opportunity to come and present some of our work here. Last night was so fascinating, one of the best dinner I have ever had in my life, and also the visit to the museum. I thank you for that too. Many small molecules present in natural products, dietary sources, are being evaluated in my laboratory for a long period of time. Over the last 2 decades, we have evaluated several natural agents from dietary sources and identified many with potential for cancer prevention and treatment. However, many of these compounds identified have met with limited success in the clinic. They work beautifully in the mouse, they work beautifully in the cell culture systems, but when we want to use them in human population for whatever reasons are, they don't work that effectively. So what are the possible reasons for this lack of success of these products in the human population? First of all, humans are diverse genetic background, so we should not expect whatever we learn from the mouse can easily be translated to the human. We have varied food habits. We eat different food. Therefore, through the process of food, we already have some kind of a effect in our body. The third and the most important thing is poor bioavailability of the active agent present in the dietary sources, which we have identified and called them as chemopreventive agents. A method of delivery of agents. In the mouse, we use different sources. We let them take pomegranate juice, for example, in drinking water and give them nothing else to drink. I don't think humans will do it. Therefore, we have to think of it. And another issue is there is inefficient systemic delivery of these agents in the human population. I would like to concentrate on issue of bioavailability. Are these agents available at the time when they need it to combat for them to do their job? Poor bioavailability at the concentrations which could be easily consumed by the human population without side effects. That's a big issue. The agent being tested might be cleared from the tumor too rapidly before it can really do its job, limiting the availability to display beneficial effects. So we introduced, and I have a story to tell. In about 10 years ago, I was in Kuwait giving a talk on natural products, and my friend Shakir Musa, who's sitting in the audience, gave a talk on nano products, and we sat for the dinner and says, can we do something together? And together we introduced a concept, what we coined as nano-chemo prevention. So if you do a search, before we introduced the concept in 2009, the internet doesn't yield anything. So we introduced the concept. Before we coined the term, the world did not return any results when searched on any internet search engines. And that was, so what is nanotechnology? I am ashamed to talk about nanotechnology because I don't know much. I learned, whatever I learned from my friend Dr. Musa. Shown on the left is a water molecule. And shown on the right is a tennis ball. In between are different molecules. So the between glucose is about 1 nanometer, antibodies are about 10 nanometer, and viruses are about 100 nanometer. So this is the range of most nanoparticles. So our approach was to demonstrate the first proof of the principle. We studied green tea polyphenol because we had a lot of experience with that in the laboratory settings. And the compound there in the green tea is called epigallocatechin 3 gallate, which is present in abundant amount in green tea, which we have considered, with which we have considerable experience. We assess the effectiveness of delivery of EGCG encapsulated in polyacetic acid PLA, polyethylene glycol nanoparticles, which Dr. Musa made it for us, against human prostate cancer cells, both in the culture systems and in the animal models, and see whether or not we can get something useful from this. So first of all, we had to demonstrate that whatever we make, nano-EGCG, is it effectively taken up by the cells? Shown here is the fluorescent image of EGCG tagged with size 3 in the PC3 cells. It is very effectively taken up. So the nano product we made is efficiently taken up by the cells we were going to work with. The second thing was, is nano product we made has its own toxicity. Shown here is on the top of the line is a straight line showing that different concentrations of the nano product we have prepared has absolutely no toxicity of itself. So the product itself we made is safe and has absolutely no toxicity. We knew it before that it takes about 40 micromolar of EGCG to kill 50% of the PC3 cells, and which is reflected by the red line there. Yes, again, 40 micromolar is required. But when we use the nano product we made, we can do the same job of killing 50% cell by 1.74 nanomolar, suggesting that we have obtained over 10-fold dose advantage. Shown on the right is the same thing, looking at different kind of an assay system in which colony formation has been used. On the bottom of the line, it's shown on the right, is a curve plotted, again showing that the EGCG encapsulated in nanoproduct works with about 10-fold dose advantage. It does the same job, whatever the native EGCG does, with about 10-fold dose advantage. How about if EGCG is encapsulated and does not retain its mechanistic identity? So we went on to establish that encapsulated EGCG retains its efficacy to induce apoptosis. One of the key features of EGCG, native EGCG, is put in the cells. We have demonstrated it before in our 1997 JNCI paper, that it effectively induces apoptosis. So based on confocal microscopic and FACS analysis, we demonstrated that the product we have made has over 10-fold dose advantage, again, in inducing apoptosis, and that work was published in 2009 in Cancer Research with a high-impact journal. Encapsulated EGCG again retained its mechanistic identity, shown from a different angle, that we put in the cell culture system, pro-apoptotic genes goes up, anti-apoptotic genes goes down, pro-apoptotic genes goes up, and that is again demonstrated here. So the product we made was very effective and taken up by the cells, so far I have demonstrated, and is able to maintain its mechanistic identity with about 10-fold dose advantage. We require about 10-fold lower dose to do the same job. Whether or not it works in the animal model systems. Shown on the right side is an in vivo tumor experiment in which we implanted CWR22 cancer cells in the thymic node mice and developed tumors. On the left is the control animals, and when we give about 1 milligram of EGCG, native EGCG, every day, about after 20 or 30 days, harvest the tumors, and we show a considerable decrease in the tumor outcome. On the bottom is shown that we have given 10 times lower dose of EGCG. Mind you that at this dose level, the native EGCG is totally ineffective. At this dose level, encapsulated EGCG was was significantly more efficacious in reducing the tumor volume. So bingo, we have shown that it works effectively in the in vivo and in vitro culture system, and that started the genesis of encapsulating natural products for evaluation of biological activity. And since then, many products have been evaluated and encapsulated in different kind of nanoparticles and have been evaluated. And whatever the natural products are doing in cancer, I believe very strongly they will do the same thing when assessed for other diseases. So we also demonstrated that nano EGCG, which we have, has a very long half-life in vivo. So it looks like to us that it is slowly released and is doing its job slowly to make it very effective. We found that EGCG, native EGCG, was rapidly degraded and cleared within 2 hours from the animals. However, we found that nano EGCG had significantly higher half-life, and it was available even after 24 hours in the animals. And since we are injecting every other day, it means the supply of EGCG is available to the animals at all the time. So from this data, we concluded that EGCG encapsulated in a nanoparticle resulted in over 10-fold dose advantage for induction of apoptosis, hallmark of cancer cell death, inhibition of angiogenesis, again, important for cancer reduction, inhibition of tumor growth and progression. I haven't shown you that data, but more importantly, it was also resulted in lower concentrations of serum PSA, which is a hallmark of measure of the prostate cancer burdens. And more importantly, we found that nano-EGCG had a higher half-life in vivo. There are issues with the PEG nanoparticle we made, and we knew it. It's not very stable in acidic environment in the gut, through which if you give orally, the drug or any other agent has to pass. So we found, looks like it's not suitable for oral consumption. So we developed, again with the help of Dr. Musa, what we call the CHIT. We linked it with chitosan, which is again a natural product, and hydroxymethylcellulose, and prepared the nanoparticles to encapsulate EGCG, and that is sufficient for, good enough for oral delivery. We got a grant from Department of Defense to show this effectiveness in the mouse model. Oral nano-EGCG is steadily released in the in vivo system. So when we give this product we made, it is released, and that's the first test. If it is not released, it's not going to do its job. Again, we did the tumor experiments and found that oral formulated nano-EGCG effectively inhibits tumor growth over 10-fold dose advantage. Shown here on top are the tumor experiments in which control animals are shown on the left. Second is EGCG given 40 milligram native EGCG, no encapsulated. When we gave the nano EGCG about only 3 milligram, which is about 13 times lower, it led to the tumor reduction more effectively than was obtained by the native EGCG. And we have done the kinetics on the left-hand side shown here to calculate a lot of different things from these experiments. And this work was published in very recently in a journal called Carcinogenesis, where we also showed that oral formulated nano-EGCG effectively inhibits serum prostate-specific antigen with over 10-fold dose advantage. Serum-specific antigen, PSA, is the measure of prostate cancer burden. When you give the nano-EGCG, and it is reduced significantly. Again, vouching that it is working. For something, we need selective targeting. Can we send the product, nano product, selectively to the prostate tissue itself so that it does not do harm, whatever it is, to any other organ, goes there and possibly will do a job much more effectively. So we have thought of considering a ligand which we call PSMA, which is present only for whatever reasons are in prostate and some concentrations in brain. So we link the EGCG with the PSMA and produced another nano product, and we call that targeted nano EGCG formulation, which we developed which is chitosan-based nanoparticle, to encapsulate EGCG surface functionalized with PSMA, specific A10 2-fluorodiamine RNA aptamers for targeting specifically to the prostate. The idea is it will go only to the prostate because possibly it will not cross blood-brain barrier to reach to the brain. We assess the effectiveness of this preparation, which we are calling as nano-EGCG apt. Using the cell culture system, we found that the nano-EGCG apt works beautifully in cell viability in human prostate cancer cells. As shown is a lot of data, but the bottom line is it is doing its job, what we were expecting it to do. Targeted nano-EGCG again retained its in vivo efficacy. We have done the kinetics of this, and we found that it retains in vivo efficacy in a different formulation systems. From these data, we concluded that chitosan-based nanoparticle encapsulated EGCG surface functionalized with the aptamer targeting prostate demonstrated that the targeted nanoparticles are selectively taken up by the PSMA cells, which is prostate cells, and that non-targeting and prostate targeting nanoformulation retains its cell growth inhibition efficacy with a decrease in IC50 by half the dose of native AGCG. It leads to induction of apoptosis, which is a hallmark for the death of the cancer of the prostate and other organs. It leads to inhibition of invasive and migrative potential of prostate carcinoma cells. It leads to inhibition of tumor growth and progression. We have not yet tested this particular formulation in the animal model system. So we have to do that. Another approach we took is we targeted nano-EGCG formulation we prepared. We developed PLGA COH-based nanoparticles to encapsulate EGCG conjugated with 2 PSMA targeting ligands to target more specifically to the prostate cancer cells. And we assess the effectiveness of these nanoparticles encapsulating EGCG against human prostate cancer cells, again in the cell culture systems, and showing that it is very effectively doing its job in killing the cancer cells. Now, no matter how we assess in terms of tumor volume in the animal or in terms of cell death occurring in the culture systems. Many other nanoparticles since then have been incorporated in the grape seed skin, through which it is present in red wine also. A compound called resveratrol is a promising natural agent for the management of cancer. We brought forth to our herb gardens of the date, palms, and grapes. It is mentioned in Quran, where is its fruits for you, and therefore you can eat. Grapes you can eat. Numerous studies have suggested health-promoting effects of resveratrol, including claims in the prevention of disease such as coronary heart disease, diabetes, and cancer. So we were interested in seeing whether we can get the benefit of this. So our approach was, we considered the possibility that nano-encapsulation of resveratrol will provide protection against degradation, enhance its bioavailability, improve the intracellular penetration, and control its delivery. So therefore, we assess this resveratrol, which we prepared through collaboration with someone else in Italy. Shown here is in vitro release kinetics of the free resveratrol and nano-resveratrol, showing that encapsulated resveratrol had longer half-life under both acidic tumoral microenvironment and physiological conditions. We compared the effect of this nano-resveratrol and resveratrol on cell growth inhibition, and shown here is the data showing that nano-resveratrol clearly demonstrated better cell growth inhibition against both androgen responsive and hormone independent prostate cancer cells. So it looks like this could be also a very useful agent. We are in the process of targeting nano-resveratrol formulation. We developed PLGA COH-based nanoparticles to encapsulate resveratrol conjugate with 2 PSMA targeting ligand. Again, the same approach we took for green tea. We assessed the effectiveness of these nanoparticles against human prostate cancer cells so far only under in vitro conditions. We show by this data here that it has a remarkable effect on prostate targeting. Shown here is that prostate targeting nanoresveratrol effectively induces cell growth inhibition. Cell viability was modulated by prostate targeting nanoresveratrol in PSMA specific manner. Targeting nanoresveratrol selectively is taken up by the PSMA positive prostate carcinoma cells. Shown on the top is LINCAP cells, PSMA positive, and shown on the bottom is DU145, which are PSMA negative. So you can see that it is very effectively taken up by the PSMA positive cells and not by the PSMA negative cells, and that was expected. Prostate targeting nanoresveratrol effectively inhibits tumor growth and progression. We did some experiment in the nude mouse, and we found that it is very selectively, you compare the bottom curve from the top curve, doing its job in the nude mouse model system, where it is much more effective than the resveratrol given as resveratrol alone. So what nano-chemo prevention or nano approach can do? Reduce the effective dose of the bioactive food compounds. We can do the job with 10, 20, 15 different agents, lower dose. Increase the bioavailability of the bioactive food compounds so that it is available at all times to do its job. It maintains a sustained release of the bioactive food compounds, and therefore in doing this reduces perceived toxicity which can occur by taking a humongous amount of the bioactive food compounds available. So whatever data I have showed for cancer possibly can also be useful for other diseases where natural products such as resveratrol, such as green tea, such as many other agents, curcumin, are showing pomegranate, are showing promising effects. So the ultimate goal from these studies is maybe one day we can create a cocktail of agents present in a nano-formulated formulation product, which humans can take one day or twice a day to retain its constant level of different products and do its job. And if it could achieve, maybe in years to come, that's a possibility, and that's the ultimate goal. One day, once a day or once a week capsule to prevent cancer, Alzheimer's disease, and many other diseases which are debilitating. So I thank you with this for your attention. And this is my lab where people working in my lab who did the work and allowed me to come here. Thank you very much for your attention.
Thank you very much, Professor Mukhtar, for this informative talk. We have actually 2 minutes for questions for the audience. Please.
Thank you for your outstanding work. I am a clinical hematologist, and we know that in order to use a product in the clinic, we need safety, efficacy, tolerability, toxicity, and pharmacoeconomic data. And production of those data is really challenging. If we performed safety, efficacy, tolerability, toxicity, and pharmacoeconomic studies in a given product, and then if we establish this product in the clinic, and then the second stage, if we encapsulate this product with nano-capsulation, should we repeat all of the safety, efficacy, tolerability, toxicity studies again? It is very difficult. I am asking this question to you because of my point of view. I live in Turkey. I am a Turkish hematologist. Yesterday, I proposed our drug, Ankafert Hemostat. This is a drug acting on red blood cells and fibrinogen, and this is now being used in the clinic, hematology, for the management of hemorrhages. And our healthcare system and then we produced Ankafert nanohemostat with encapsulation, and our health authority asked us all of the safety, efficacy, tolerability, tox studies again for the nano-encapsulated product. We told them that it is not fair because it took almost 15 years to develop this product in the clinic. They told me that this is another product. Forget about the first studies about Ankafert. Perform the same studies for Ankafert nanohemostat. I would like to ask you from 2 points of view. First, your view about this point, and then what about your products? Also, you should perform the same studies for the nano product as well as the original product. Thank you so much.
Thank you for asking the question. I don't believe that in detail safety, pharmacokinetics, and toxicity studies are required, because all we're doing is delivering the same agent at a lower concentration to do its job. Of course, before we finally do it, we have to really quickly determine that it's safe. And that will be my approach, rather than doing in-depth studies to analyze its toxicity and everything.
Okay, I think for the sake of time, we'll just thank Professor Hassan Mukhtar again for this excellent talk. And we move to the second speaker. Second speaker is Dr. Ayman Al-Qadi from King Abdulaziz University. And he'll be talking about the mechanism of action of black seeds on human colon cancer.
كونفرنس توك فوق. لا ده بي ده باوربوينت فوق بي اف على طول. افر طيب. طب في بوينتر؟ انا مش شايف فين البوينتر. لا عايز بوينتر هنا مفيش.
دي ايه ده؟ المايك شغال انا كده. السلام عليكم. I am going to talk about mechanism of action of Nagella sativa saponins on human colon cancer cells, the suppression of AP1 and the NF-kappa B transcription factor, and the induction of cytoprotective genes. Introduction: colon cancer is the third most common phenotype of cancer and the second leading cause of morbidity and mortality in the world. Although most of the biological activities of Nagella sativa seeds have been attributed to thymoquinone, the seeds contain too huge amount of saponins. Nonetheless, little attention has been paid to these saponins. Saponins from numerous plant species have been shown to possess chemopreventive and chemotherapeutic properties. So our aim was to investigate the growth inhibitory potential of crude saponin extract. From now on, I will call it CSENS, prepared from medicinal herb Nagella sativa on human colon cancer cells, HCT116, and further to elucidate the molecular mechanism underlying this action. First, this is a MTT assay showing saponin inhibited proliferation of cancer cells. Here we can see colon cancer cells. Saponin inhibited growth of cells in time and dose-dependent manner. When we repeated this experiment using other cell lines, breast cancer cell lines and liver cancer cell lines, we get similar effect. Next, we found saponin inhibited growth of colon cancer cells. It is well known cancer cells can form colonies, and these colonies can grow larger, and finally they can coalesce and form a big colony like this. So when we treated cells at this stage with saponin for control cells, we found the cells formed big colonies like this. In case of treated cells, we found saponin reduced the size and number of colonies. So these two features, inhibition of proliferation and inhibition of growth colonies, are important result proving anti-inhibitory activity of saponin. Most chemotherapeutic agents exert their activity through induction of apoptosis in cancer cells. So here we can see colon cancer treated with saponin. We can see feature of apoptosis such as deformed shape by phase contrast microscope. When we stain the cells with GEMS stain, we can see the same result. This is the control cells. You can see clearly cells. You can see clear nucleus with distinct nuclei. And when we add saponin, cells start to shrink and more shrinkage, and finally the cleavage and form apoptotic bodies. And we can see here chromatin condensation. All these features, cellular shrinkage, rounding up, formation of apoptotic bodies, and the concentration of chromatin are hallmarks of apoptosis. Okay. Next hallmark of apoptosis, DNA damage and fragmentation into oligonucleosomal ladders. Both these characteristic feature, DNA damage and formation of DNA ladder, have been found in cells undergoing apoptosis induced by a variety of agents. To see whether saponin can induce DNA damage, we did a test called the COMET assay. In this COMET assay, we have here the cells. I will give very brief about this procedure. We have the cells here, intact cells. Okay, and when we add chemotherapeutic agent, in our case will be saponin. Saponin degrade DNA. So when we lyse these cells and subject them to electrophoresis under pressure of the current, degraded DNA migrate out of the nucleus and form a big halo like this. This big halo, it is called comet tail. It is a characteristic feature of apoptosis, of apoptosis induced by chemotherapeutic agent. Here is the real picture, control cells, and we can see comet tail, bigger and biggest comet tail. Next feature is fragmentation of DNA into ladder. Here we can see these control cells. We have intact DNA. This is agarose gel electrophoresis. And when we treat cells with saponin, we can see formation of DNA ladder. And clearance of ladder appears with increasing doses of saponin. Okay. A hallmark of cancer cell growth is high expression of antiprotective proteins, especially BCL2, and low expression of pro-apoptotic proteins, especially BAX. But there are other pro-apoptotic and anti-apoptotic proteins, but these both are much more important. Okay, so cancer cells have high expression of BCL2, which tips the balance toward formation of oncogenesis or tumor and support survival of cancer growth. When we add saponin, it turns the balance toward inhibition, induction of apoptosis and inhibition of cell growth. We can see here Western gel showing expression level of BCL2 goes down with increasing doses of saponin. On the other hand, expression level of BAX goes up with increasing doses of saponin. To find out the molecular mechanism underlying anti-cancer potential of crude saponin extract, we studied the effect of saponin on the activity of the transcription factors, NF-κB, AP1, and nuclear factor 2. We decided to study these transcription factors for some reason. First, the great majority of known oncogenic pathways act through NF-κB and AP1. NF-κB and AP1 also have specific rules in inhibition and the progression of colon cancer, and they support or they augment chemo resistance and radio resistance. Nuclear factor 2 is a master regulator of cytoprotective genes. Those genes inactivate external and internal carcinogenic species. We can see here many cytokines and growth factors bind to their receptors upstream here on the cell membrane, and they activate series of signaling pathways leading to activation of NF-κB or AP1. And both proteins, since they are transcription factor, they activate transcription of genes involved in cell survival and growth. Furthermore, you can see here both proteins AP1 and NF-κB augment their activities. There is a positive feedback loop between them. For example, AB1 activate NF-κB through this pathway. And NF-κB again activate activity of AP1 through this feedback loop. Okay. NF-κB and the nuclear factor 2 has antagonistic rules in the cells. So NF-κB activate cytokines and other factors leading to survival, growth, and proliferation, and ultimately into neoplasia. On the other hand, in nuclear factor 2, inhibit activity of NF-κB through this feedback mechanism. So that's why we were interested to study activity of the three transcription factors. Okay. So we found saponin down-regulated transcriptional and DNA binding activities of NF-κB. When we treat cells with saponin, we found activity of NF-κB, transcription activity of NF-κB goes down with increasing doses. Why? Since saponin inhibit binding of NF-κB to its site. Actually, in cancer cells, NA في كابا B is constitutively bound to its binding site, activate transcriptional machinery, leading to production of oncoprotein, simic, servine, cyclin D1, and other molecules involved in cancer growth. So when saponin inhibits this binding, it inhibits transcription of these genes. We can see here this downstream effect of NF-κB. Indeed, their expression go down. Simic go down. These are GPCR showing the messenger RNA of this gene, simic. Cyclin D1, servivin, all these oncogenes, their activity went down with increasing doses of saponin. We get nearly the similar effect for AP1, decreasing activity of the protein, which was due to inhibition of its binding to its site in the cell. On the other hand,
2 minutes, please. 2 minutes.
Yes, just 2 minutes. Two slides. On the other hand, saponin augmented transcription and DNA binding activity of nuclear factor 2. We can see here activity of the nuclear factor 2. Its transcription activity increases with increasing doses, and its DNA binding activity increases with increasing doses. Here is the mechanism. Probably I don't have time to go through it. And here we can see this HO1, NQ, R, UTG. All these are effector of this factor. Finally, we checked the effect of saponin on some known oncogene and the tumor suppressor gene. So we found saponin upregulate expression level of B53, the guardian of genome, and B21, the cell cycle inhibitor. On the other hand, it downregulate expression of oncoprotein ERIC1, 2, and cyclin D1, cyclin D4, COX2. So we conclude from this result that saponin has a potential anti-proliferative or pro-apoptotic activity against colon cancer, and can provide useful foundation for studying and developing a novel therapeutic agent for treatment of this disease. Thank you very much, and thank you for your attendance. Assalamu alaikum.
Thank you very much, Dr. Gadi, for this good work. I think for the sake of time, we'll skip the question part, and I'm sure Dr. Gadi will be around. Dr. Gadi will be around for any question, but for the sake of time, we have to move to the other speaker, please. Dr. Gadi, thank you very much. Dr. Gadi, thank you very much for the gift from the
thank you very much.
Conference. Okay, so our next speaker is Professor Safiya Al-Attas from King Abdulaziz University, and she will be talking about the use of black seed in preventing oral cancer.
الرحمن الرحيم اللهم علمنا ما ينفعنا وانفعنا وزدنا علما. First of all, I would like to thank the organization committee for giving me this opportunity to present our research in Nigella sativa extract, chemo prevention in oral cancer in vivo study, and this is my research team. My presentation will include the following outline: introduction, objectives, material, methods, results, and conclusion. Starting with the introduction, I am a dentist, and the worst cases that we see in the clinics are the oral cancer cases. When we say oral cancer, we mean cancers that involve anywhere in the oral cavity, involving the lips, tongue, floor of the mouth, gum, buccal mucosa, as well as the palate. Oral cancer is a multi-step disease of accumulated genetic and epigenetic alterations in the epithelial cells. These alterations precedes where is my pointer? Precede the histopathological changes, as you can see here, and it's accumulated throughout the malignant transformations from the benign hyperplasia to dysplasia to carcinoma in situ and to the invasive cancer state. Oral cancer unfortunately exhibits a low 5 survival rate that remains unchanged over the past 3 decades. It's remained around 50 or less. It has high mortality and morbidity. However, early treatment could increase the survival rate up to above 80%. On the other hand, cisplatin is a commonly used chemotherapeutic drug in oral cancer treatment, especially in the advanced stages. However, the long-term use of these drugs may be associated with many side effects, complications, and drug resistance. Inspired by حديث الحبة السوداء شفاء من كل داء إلا السام, we started to review the literature for possible hope to cure this disease, and we found that Nigella sativa extract and its active ingredients, thiamoquinone, have many anti-cancer effects through different mechanisms. However, the literature and the effect of the Nigella sativa, as well as its constituents in the oral cancer, are scanty in the literatures, and we found actually with the PubMed 3 articles, 2 in vitro and 1 in vivo. The authors of the in vivo study reported that oral administration of thiamoquinone at a dose of 30 milligram per kg succeeded to reduce the tumor formation in the DMPA-bented hamsters for 14 weeks. Application of the DMPA is a well-known carcinogenesis protocol in which they apply the DMPA in 5% 3 times a week to the buccal pouches of the hamsters, and by the end of this week, 14 weeks, the hamster developed squamous cell carcinoma. It's found to be the ideal model for oral cancer. It's present the events of the oral cancer stages from the starting with the benign hyperplasia to the dysplasia to the invasive cancerous state. So most of the scientists considered the application of DMPA for 5 to 6 weeks initiate the pre-malignant stage of the oral cancer. To the best of our knowledge, up to now, there has been no published study determining the effect of Nigella sativa extract on the pre-cancer stage of oral cancer, or to investigate the chemopreventive effect of the Nigella sativa extracts in oral cancer. Also, there is no previous study have investigated the effect of combination of Nigella sativa with the cisplatin, as the combination of the cancer treatment received increased attention nowadays because of the potential of enhancing the therapeutic effect as well as reducing the toxicity of the drugs by lowering the dose of each agent. So the aim of our research was to test the chemopreventive effect of the Nigella sativa extracts in oral cancer, including the pre-malignant stage, and also to test the combination effect of cisplatin with Nigella sativa extract in oral cancer treatment, including the pre-cancer stage, in comparison to each agent alone. Methodology, it was a preclinical study approved by the ethical committee of KAU Faculty of Dentistry Board, ethical board, and it was extended to 14 weeks. It's included 50 hamsters of the male golden Syrian hamsters aged from 8 to 6 weeks, distributed into 10 groups. Each group consisted of 5 hamsters. 2 of them served as a control negative, that's negative control didn't receive any carcinogens or any treatment, just normal saline or Nigella sativa extracts solely. And the remaining 8 groups received 0.5 DMBA in a liquid paraffin applied by benching brush to the left buccal pouches of the hamsters, either for 6 weeks to produce pre-malignant stage of cancer, or for 14 weeks to produce squamous cell carcinoma. 6 group of the groups that received DMBA serve as a treatment group and received one of 3 forms of treatment, either Nigella sativa extract given in oral dose, also 3 times a week in a dose of 30 milligram per kg, and alternative days to the DMBA application, or to receive cisplatin in intraperitoneal injections once a week at a dose of 35 micron per kg, or in a very low dose of 8 micron if it's given in combination with NCE. As I said, the experiment extended for 14 weeks. By the end of the experiment, we took blood, periorbital blood from all the hamsters for kidney and liver function as well as CBC. And then we sacrificed all the hamsters for histopathological and immunohistochemical as well histomorphometric study. The histopathologic grading was done according to WHO 2005, and immunohistochemical staining done for caspase 3 as indicator for apoptosis, and Ki-67 antibodies as indicator for proliferations. Again, back, as I said, we have 50 hamsters distributed into 10 groups. 2 groups, Group 1 and 2, serve as a control negative group, received only saline, no carcinogens, no treatment, while the group number 3 and 4 served as a control positive group, received the carcinogens for 6 weeks to produce pre-malignant stage, or DMBA for 14 weeks to produce squamous cell carcinoma. The remaining 6 groups divided into 3 forms of treatment, mode of treatment, either with Nigella sativa alone, or cisplatin, or combination, in a manner that each treatment mode included both DMBA 6 weeks or DMBA 14 weeks. This is the cages of the hamsters in King Fahd Research Center. The results show the following. Starting with these clinical pictures of some hamsters in different groups. This is the normal pouches usually seen in the group 1 and 2. And while the group that received DMBA for 6 weeks, all the hamsters in this group shows various changes, starting from thickening or white lesions or papillomatous changes. The group that received DMBA for 14 weeks shows different sizes of lesions. The most aggressive lesions was seen in this group. Some shows ulcer that extend up to the skin. However, with the treatment, with the different mode of treatment, the groups that received Nigella sativa, the tumors became smaller in size, but not as efficient as smaller as the group that received cisplatin or the combination treatment. This is the histopathological specimen, shows the different changes. This is the normal mucosa seen in group 1 and 2. It shows just a few layers of epithelium. While when we applied DMBA for 6 weeks, as we can see here, it started to show mild dysplastic changes. All the hamsters in this group shows mild dysplasia, while the group that receives DMBA for 14 weeks without any treatment, more than 66% of the group shows squamous cell carcinoma, and the remaining shows severe dysplasia. Upon treatment with Nigella sativa alone, it succeeded to prevent the dysplastic changes to occur in 40% of the group that received the DMBA for 6 weeks. Also, Nigella sativa succeeded to drop the squamous cell carcinoma to 25%. Just only one case shows squamous cell carcinoma in the group that received DMBA for 14 weeks, while the rest shows only mild dysplasia. No more cases of severe dysplasia, which means Nigella sativa extracts have chemopreventive effect, but unfortunately not efficient at the cisplatin application in high dose. As all the group in the cisplatin, none of these cases shows any dysplastic changes, it's just hyperplasia. With long-term exposure to the DMBA for 14 weeks, also all the cases here, the cisplatin succeeded to prevent the progression of the mild dysplasia to severe or squamous cell carcinoma. We didn't find any case of squamous cell carcinoma or severe dysplasia in this group. But more interestingly, the group that received the combination treatment, as we can see here, in the group that received the DMBA for 6 weeks, the combination treatment shows the synergistic effect of the cisplatin and the NCE, because as we can see here, we almost reached to the normal thickness of the epithelium with no dysplastic changes, only suprabasal apoptosis. Similarly, with long exposure to DMBA for 14 weeks, the combination succeeded to reach to the almost normal thickness with just little focal areas of apoptosis, dysplastic changes or atipia, as well as many suprabasal apoptosis. This bar charts summarize the results. As we said before, the severe changes occur at the DMBA application for 14 weeks. More than 66% shows squamous cell carcinoma. The rest shows severe dysplasia. With NCE, Nigella sativa, the plant succeeded to drop the percentage from 66 to 25, and there were no more severe dysplasia, just mild dysplasia. But it was not effective as the low dose of cisplatin or the combination of this of the high dose of cisplatin or the low dose of cisplatin in combination with Nigella sativa extract, as all the cases 100% shows just mild dysplasia. To understand the mechanism of the plant and the drug, we did the immunohistochemical study and histomorphometric study, and we stained the tissues for caspase-3 as an indicator or biomarker for apoptosis. Normally, as we can see, there is little apoptosis in the basal or suprabasal layer. However, with the application of the stain, we can see there is a significant increase in the caspase-3 area percent in the treatment group, with both the low exposure as well as the high exposure time, which means that both cisplatin and Nigella sativa extracts possibly has caspase-3 dependent apoptotic activity. But unfortunately, when we compare the treatment group with the group that received the carcinogen without any further treatment, in both the short-term exposure as well as the long-term exposure, there was no significant changes. The possible explanation for this is that, as it is documented in the literature, both cisplatin and Nigella sativa have caspase-3 dependent apoptotic activity, and also with the dysplastic changes and the malignant transformation, we have also increased in the apoptotic figures. That's why possibly we didn't find any significant difference between the group. However, on the other hand, staining of the tissues with Ki-67 antibody, which is a marker for cellular proliferation, we can see here very obvious the position of this marker in the normal tissues is very scanty. However, in the treatment group with short-term exposure of DMBA for 6 weeks or 14 weeks, there is a high significant difference in the deposition of this dye. And this is expected because there is because the proliferation and dysplastic changes and proliferation of the tissue with the application of the DMPA. But more interestingly, that when we compare the treatment group with the control positive group that received the DMPA without treatment, we found also high significant difference between the group. But as we can see here, there is the difference was due to decrease in the deposition of the stain in the tissue, which means that the drugs succeeded to have anti-proliferative effect. And you can see here the synergistic effect between the drugs, where there is maximum decrease in the deposition of the stain. This is applied also to the long-term exposure of the drug, of the carcinogens. There is maximum proliferation in this stage, and also with the treatment there is decrease in the deposition of the stain due to anti-proliferative effect of these drugs. And also again, the combination of the drugs shows high synergistic effect between cisplatin and NCE. And this could, we can say that the synergistic effect of the drugs is due to their anti-proliferative effect more than their apoptotic effect. Finally, this table summarizes the differences in the blood test between the groups. As we can see here, there is no significant difference between the group in any parameters, including CBC, liver function, or kidney functions. However, when we actually read the results of the liver function test and the kidney function test, we found that the worst results were among the group that received cisplatin, and the better results were among the group that received NCE. And the drugs that received the combination drugs were in between. So we can say that Nigella sativa extracts is a non-toxic drug, and more importantly, it reduces the toxic effect of the cisplatin in this vital organ. To conclude, we can conclude that Nigella sativa extract have chemopreventive effect into oral cancer. It succeeded to prevent the progression of the pre-malignant to malignant, and succeeded to treat the pre-malignant in 40%. And more importantly, it potentiates the anti-cancer activity of cisplatin and reduces its side effect on the vital body organ. However, we recommend further preclinical and clinical studies to be done to understand the molecular basis of the mechanism of action of this miracle plant. This is my references, and this is my team that my internship doctor that I would like to thank to help me in the animal. And thank you all for listening.
Thank you very much, Professor Attas, for this excellent work, actually. We'll open the floor for questions. We have time for a couple of questions. Any question from the female side? Okay, go ahead, doctor.
My name is İlhan Yıldız, coming from Turkey. I am just wondering, do you think to carry your research to clinical practice, and is that research could be a hope for oral cancer patients? Thank you.
I think we have to think about the preclinical studies to be done, but we need still, as I said, further preclinical studies before we start the clinical trial. This is my answer, as I guess.
Okay, so they need more in vitro, I guess, studies before the implement is clinically. I'm not sure if it's ethically possible to implement such therapy now. Would it be?
Ethically to start? Do you
to
mean?
start, yeah, on human.
Based on yesterday presentation, the there was a doctor who presented the steps for methodology for starting the clinical trial. What I understand from his presentation that we should start several preclinical studies before we start to the clinical trials, and this should proceed to many committees to get the ethical approval from the FDA and worldwide, worldwide I think also approval to start a clinical trial.
How about if you use it for synergistic effect? Will it still be an obstacle to start that clinically as a synergistic effect together with the routine chemotherapy?
Do you mean because of the synergistic effect you want to start the clinical trial?
That's right. Just use black seeds together with the.
It is non-toxic drugs. Maybe if we, I don't know. I don't want to say that we have to start. I'm not in the position to say that, but because it says most of the literature shows that the plant is non-toxic. And it has it has synergistic effect with cisplatin, and it reduces the nephrotoxicity of the drug. I found that in several reports. I might advise the patient to take it just in a few doses. It's also the doses that we give usually it's small doses. In most of the studies, they said the dose that should be given, should be given يعني تقريبا 7 حبات up to 9. This is what I saw in the literature. So I maybe I might advise the patients to take during the chemotherapy to reduce at least the side effects of the drugs.
Dr. Abdulaziz?
Assalamu alaikum. Thank you, Dr. Safa. Really, it's very impressive, mainly because you concentrated on the experimental animal work. And I feel we still have a lot to do and share for example, the amount of extract. How much did you evaluate the concentration of the extract? I mean, we can go to the basic part of it, and I think it's lovely to keep controlling this as a basic foundation in order to go further to the human. Thank you, and we are all welcoming to share with you all this lovely understanding of the basic principles of research. Thank you.
Thanks a lot, Prof. Islam. This is what we need, with cooperation with the pharma people to help us to the dose that we used in the research is based on the literature review, actually. But we need to, if we want to continue the preclinical studies, I think we have to get we need to cooperate with the pharma people to decide the actual dose. And I found many articles on the thiamquinone, but in Nigella sativa extracts, this is what we found. We showed the minimum dose that in the literature for oral dose.
I agree with you, Doctora, because what I can feel that we don't cooperate, and King Fahd Research Center is full of researchers, but our society, we are individualizing, everybody working and closing themselves within their lab only, or maybe between themselves and their colleagues. So I feel the Nigella sativa has been a very interesting material, but till now, there is no standardization for it. I mean, when we're talking about the extract, how much of the principles and what type of extract? I mean, there is very, very simple understanding of the basic material. We are all willing to work together. Thank you, Doctora.
Thanks, Prof.
طيب دكتور عبد العزيز جفري، بالنسبة للجرعة ثم آتي للبحث الدكتورة. بالنسبة للجرعة محددة، الكمية لا تقل الكلية والكبد وقاية كاملة والوقاية ناقصة، 5 ملغ أو 8 ملغ وقاية كاملة. 2 حسب اليوروبيان ايجنسي فور فود قالوا 3 إلى 4 جرام 50 ملغ للكيلوغرام انها اتس نورمال از ا دايت. أولاً هذه it's a food item. It doesn't need preclinical studies. We wasted 20 years for that. Anyhow, science is not a waste. Science is not a waste. But we should have done both clinical and these basic sciences clinicals together, because the people are already using it. So what's the point of going into 20 years of that? Second thing, there are already clinical studies, and several, not one or two, several studies are there. Already results are there with these doses. And the toxic dose is already decided. So I think we are late, too late. We need a lot of research for the details. How many times a day, for how long, for acute, for chronic, for cancer. For a low immunity of a patient or cancer, you may need to increase the dose with no harm. 2 or 3 or 4 times or 5 times. 5 grams, 3 times a day. No harm in that. Okay, about the protective effect for the cancer, it's clear that this gives a very good hope, and I thank the researcher for that, so that we have better results from our chemotherapy, least side effects, we can use less dose and with least toxic effects without harming the liver or the CNS or the kidney or other organs.
Professor Attas, do you have any response?
I would like to thank him for this valuable comment. No further comment.
Yeah. Okay, but I don't see it's legitimate to start somebody with oral cancer on black seeds alone as a standalone treatment without having a clinical evidence that it would work. Wouldn't you agree?
There are already a lot of studies about cancer in various organs.
Okay, but we're talking about oral cancer. So if we're talking about a certain cancer, then I have to have an evidence that black seeds work as a standalone treatment before I do start using it without any evidence base.
At the beginning, I think we can use synergistic effect of several antioxidants, natural antioxidants also, together with the black seed. It may have, it's proven to have synergistic effects. This is one thing, to be a safer side with cancer. Of course, at a certain point, you have to give the patient the choice. If he's severely ill, debilitated, he's very afraid of chemotherapy. Why not give him the choice? We are not giving him the choice. Either you take this or you die. This is the choice that we're giving to the patient.
Okay.
Can I interfere, please?
In 30 seconds, please.
I would like to say that there are patients who are already lost hope and they will accept anything. This is not wrong. I mean, with the consent of the patient, and there is nothing to stop that. But it doesn't mean that we are establishing basic foundation for long term. And as you can see, many drugs which are released after FDA and then they are withdrawn from the market.
Sure.
I mean, we cannot ignore that. But it's nice to be enthusiastic and keep, but with very clear, not bluffing the patient. This will risk you from take say the camel milk, and you will be recovered. Forget about chemistry, because these chemicals are no good anymore. I mean, we are enthusiastic, and we should help our profit education and health, but we should not ignore or blind the patient. Thank you.
Thank you very much.
Allow me, seven seeds story in hadith by Aisha radiallahu anha. This is to be put in the nose, not for the whole body.
Yes.
This should be clearly cut and ended. This discussion should be ended. Rasul sallallahu alaihi wasallam left us the choice to experiment, to measure, and to give our experience and to notice. For the doctors, he gave us only the beginning foundation, and that's enough for us.
Okay, thank you very much all. We have to adjourn this session. It's time for a coffee break. I think we can continue discussing this issue in the coffee break. We have to be back, kindly be back at 10:45, please.
You know,
10:45.
The growing area, even where you plant the Nigella sativa, can affect the content on the active principle of that seed. So, I mean, there is a lot of things to look at. we need to cooperate. All I want to say. Thank you.